My name's Erica Butler. I'll be doing your assessment today. What's going on?
I've just
Had a cough.
had a cough for a few days and
Mhm.
just can't seem to kick it.
Okay. How many days?
3 to 4.
Okay. Have you been coughing anything up or fever? Anything like that? Just kind of in a deep cough, kind of a cough more in the back of your throat?
Deeper cough.
Deeper cough? Okay. Alright. Anything else going on? No fever, throwing up, nausea, diarrhea, anything like that?
No, ma'am.
Real quick, I'm going to go over your past medical history. Any childhood illnesses?
No, ma'am.
Anything you take medication for every day?
No, ma'am.
Have you ever had surgery?
Surgery on my elbow?
On your left elbow?
Yes.
How old were you when that happened?
17.
And what exactly happened?
I knocked the tip of it off playing basketball.
Okay. Any type of psychiatric history?
No, ma'am.
Family history? Anything that your parents or grandparents or anything you know specifics?
My dad had hypertension.
Okay. And is he still living?
Yes.
Is your mom still living?
Yes.
Okay. And she has no medical problems?
Not that I'm aware of.
Okay. On your personal and social history, do you drink alcohol?
Yes, ma'am.
How much do you drink a day? Is it just on the weekends? Is it 3 or 4 beers a day, 3 or 4 beers a month?
3 or 4 beers a day, probably.
Okay. And how many years have you done that?
15.
Okay. Do you smoke?
Yes, ma'am.
How much do you smoke a day?
Half pack.
And how many years have you done that?
15 years.
Okay. Do you do illegal drugs? Any type of pain pills, anything?
No, ma'am.
Okay. Alright. I'm just going to do a quick little interview here. How old are you?
38.
And what do you do for a living?
I work in a bank.
As a banker? Okay. And this cough started, have you been around anyone that had been ill? Traveled outside the country? Been around anyone?
No, no.
Okay. Just kind of came on?
Other than normal business.
Okay. You said it's a deeper cough. Do you say that you're able to clear your lungs after coughing or no?
Yes, ma'am.
I do clear. Do you have any pain with that?
No.
Do you notice it more in the mornings, afternoon, evenings? Is there a certain time that your cough is worse than others?
Mornings and evenings.
Okay. Is that typically when you're smoking more?
Could be.
Okay. Have you ever tried to stop smoking?
A couple times.
And what have you tried? What types? I mean, like gums or
No,
patches, just cold turkey?
Mhm.
And what's the longest you've been able to quit for?
4 years.
Okay. Do you notice if cough drops or drinking a warm tea or anything like that, does that help at all?
Cough drops will help.
Cough drops, okay. And then there. Okay. All right. I'm going to go ahead and begin the physical exam. At this point, I would wash my hands, and I'm going to start and assess your hair, your skull, things like that. Make sure everything's evenly distributed. And I don't feel any type of lumps or masses. Is anything tender on your head?
No, ma'am.
Okay. I'm going to go ahead and palpate your sinuses and feel on those. If anything hurts or is tender in an area, be sure to let me know, okay? Will that feel all right?
Yes, ma'am.
Any tenderness in there?
No.
Okay. Let me go ahead and listen to your temporal arteries. I'm going to do that with the bell of my stethoscope. Okay. That's good. I don't hear any swishing noises or anything. Okay. I'm going to do some cranial nerve test right now. Could you smile and frown? Puff out your cheeks. Okay. Show me your teeth. Squeeze your eyes shut. Great. Thank you. I'm going to do another type of nerve deal. It's called a sensation. I'm just going to lightly touch you, and you tell me if you feel it, okay?
Yes. Yes.
Okay, those seem to all be intact. Okay, go ahead. Let me grab my light real quick. I'm going to check your nose, the patency of it. Could you hold one side and blow? And on the other? Perfect. I'm just going to look up inside to see if I see any drainage or ulcers or masses or anything. Nope, everything looks lined up great. Okay, in your mouth. Okay, say ah. Okay, you're telling me everything looks really nice. Any dental problems, anything like that? Loose teeth, chipped teeth?
No.
Everything in there looks nice and moist and red. I don't see any broken teeth or anything like that. Okay, I'm going to turn the lights off so I can assess your pupils, okay? I'm going to do that moving from the in to the out. I just want you to pick a spot and look at it. Okay, those dilated perfect. Again, perfect. Do you wear glasses?
Yes, ma'am.
Okay. At what age did you begin wearing glasses?
27, 28.
Okay. This, I'm going to look for your red light reflex. Then I'm going to go on in and look for any hemorrhages in your retina. Then I'm going to go on into the optic disc and see if I see any bulging or cupping, okay?
Okay.
Just look straight ahead. I guess I need to go to the other side. I'm sorry, give me just a second. Okay. Okay. I'm just going to come in a little closer as I look for any hemorrhages. I see your arteries. I see no hemorrhages. The optic disc does not look like it's bulging or cupping at all. So that's good. Sorry about that. Okay. Okay, I want you to cover one eye, look straight ahead, and cover the other. Okay, did you notice any differences? Are your eyes able to focus and all that?
Yes, ma'am.
Okay. Next we're going to do the Snellen Vision handheld chart. What I want you to do is just hold it like you were reading a book. And first with both eyes, tell me the smallest line you can read.
Third from the bottom.
Okay, go ahead and read it.
374256.
Okay, cover your left eye. Smallest line.
Same.
Okay, and with your other eye, please.
Same.
Okay, thank you. So that's 20/30 vision. That's good. And I'm going to move on to your ears. Have you had any pain or drainage or swelling or anything in your ears?
A little bit of drainage.
Okay. Has it been watery or pretty yellow?
Yellow.
Okay. Let me go ahead and pull up and look in. little bit, but your tympanic membrane looks nice. Doesn't look red or inflamed. Check the other one. Do you have any problems hearing? No? Okay. Well, I have 2 quick tests I do on your hearing. If I could have you sit up on the edge of the bed, or even just like that if you're comfortable, it only takes a moment.
Okay.
Okay, this I'm going to tap it and then put it on the top of your head, and you'll hear it more in an ear if you've lost some hearing, okay? Do you feel it evenly?
Yes.
Okay. This one, I'm going to check and see, once you quit hearing it vibrate, then I'm going to move it out here, and once you quit hearing it vibrate out here, I'm going to take it away, okay?
Okay.
This is the Rhine test.
Okay.
Okay, great. Okay, you can go ahead and lean back. Okay. Sorry, here, let me get my notes in order. Okay, and I'm going to move back to your mouth for a moment. Okay, I'm just going to check your lips, make sure there's no cracking. Could you go ahead and lift your tongue for me? Good job. All right, have you been able to eat and drink and all that?
Yes, ma'am.
No problems with that? Okay. Here I would check your gag reflex, but I'm pretty sure it's intact. Okay, I'm going to move on to your neck. I'm going to palpate your thyroid first. And I may have you sit up for that. If you could swing your legs that way. Okay. And what I'm going to do is as I push this way, I want you to swallow. And again this way, okay?
Okay.
I'm going to push pretty hard. Great. Great. That was very good. Didn't feel any masses or anything with that. The lymph nodes, go ahead and look for any swelling in any of those. Do you have any tenderness or pain with any of these?
No, ma'am.
Anything up here?
No.
Okay. Now I want you to kind of do a range of motion with your neck. Okay. Can you show your shoulders? Okay. Now just relax and against resistance. Okay. And put your head against. Good job. Okay. I'm going to try to get you to lay at about a 45-degree angle, and I'm going to check for any jugular vein distension, okay? And this, I use 2 rulers. You can just lay flat on your back, I'm sorry. Okay. Just try to lay down on the pillows just a little bit more. I'm sorry, I need your head to come down on the pillows. There you go. Okay, and again, like I said, I'm measuring for any jugular vein distension, okay?
Okay.
This is a long ruler. Okay. And that is at a 6.5. Okay. All right, so that looks great. Now, I'm going to go ahead and move to your lungs. First thing I'm going to test for is called tactile phlebitis. If you could go ahead and put your legs on that side. I'm going to place my hands on your back, and I want you to say 99.
99.
Okay, kind of curl your arms in and kind of give yourself a little hug on the front. Okay, again.
99.
Good. Okay. Now I'm going to check for the diaphragmatic expansion. I'm going to go down to about the 10th rib. And I want you to take a deep breath in and out. Great. That's nice and even. Okay. I'm going to go ahead and percuss, see if I hear any dullness or areas of concern. And right now that all sounds great. Okay. Well, that looks good. I don't hear any hyperresonant or dull sound or anything like that. Okay, now I'm going to try to percuss to the level of your diaphragm and see the width of it, okay?
Okay.
So I want you to take a deep breath and hold it. Okay, I'm going to measure about right there, and I'm going to start from the bottom and go back up. Okay, so I'm going to say it's about right there, definitely between, I would say, right at about 3 inches, so that's good, 2 to 3. Okay, now I'm going to listen to your lungs. Please take a nice deep breath. Okay, deep. Again. And one more time. Good job. I'm also going to listen on the lateral lungs. Take a deep breath. You've got great air movement through there. I don't hear anything associated with your cough. Good. That would make me think your lungs are full of anything, so that's good. Okay, if I could get you to lay back again, I'm sorry for all the moving around. Okay, at this point I'm going to start with your chest, okay? And on your back, I did note that you had a couple moles. Have you had any problems with those? Any bleeding or?
No, ma'am.
Okay. They didn't look like they were sloughing or anything like that. So, again, I don't see any open areas or sores. Maybe a freckle or two, but nothing to be concerned of. Okay. I am going to palpate through and see if I feel anything. Any pain, any tenderness anywhere?
No, ma'am.
Okay. I am going to listen to your lungs. Deep breath. These are the anterior side of your lungs, which is the front. Okay, again, I don't hear anything of any concern. Good job. Okay. And now I'm going to listen to your different arteries. So the first one I'm going to go to, excuse me here, is, a second. Okay. First, I'm going to listen to your aortic, which is at the second intercostal. I'm going to move over to the second intercostal for the pulmonic. And I'm going to move down to the third for the Erb's point, the fourth intercostal for the pulmonary. Tricuspid, I'm sorry, excuse me. And down for your mitral. Okay, great. All those sound very good. And now, so I'm going to find your point of maximal intensity, which is typically down here. Okay, great. I'm going to check all of your pulses real quick. First, I'm going to do your carotid. Okay, those are about a 2. Those are nice and strong. I'm going to do your brachial. Also nice and strong. Your radial. Your femoral pulse is in your groin. Okay, and I'm going to move down to your popliteal, which is behind your knee. Good. And then onto your feet. Your dorsalis pedis. That's good. Okay, those are all good. All right, now I'm going to go on into your abdomen, okay?
Okay.
And you've been able to eat fine, not having any loss of appetite or anything. Generally have a healthy diet, breakfast, lunch, dinner, all that. Okay. The contour of it looks nice and smooth. I don't see any bulging or anything like that, just looking. Next, I'm going to auscultate for any types of abnormal sounds, okay?
Okay.
I'm going to listen in all 4 quadrants. Okay, I hear nice vowel sounds present in all 4 quadrants. And I'm going to now percuss where your liver is. It's over here on your right side. So for that, okay, so it's usually an area of dullness, all right? Now I'm going to try to palpate it. So that's kind of up under your rib cage. It may be uncomfortable a little bit. Just take a deep breath in and hold it. Okay, and I'm not able to palpate it. Sorry. And I'm going to go to the other side and do the same thing, but this side for your spleen. Okay. Okay, I don't hear anything on this. Again, I'm not able to palpate your spleen right now, so, and that's all normal. So, can typically only palpate if they're enlarged. Now I'm just going to palpate your tummy. And I'm going to start with a light palpation, and if you're able to tolerate that, then I'll move on to the deeper, okay? Any pain or tenderness with any of that?
No.
Okay, just kind of try to relax. I'm going to do a little bit of a deeper palpation. All that okay?
Yes, ma'am.
Okay. And now I'm going to do some musculoskeletal deals, okay?
Okay.
So, move that for a second. And on the musculoskeletal, with you lying down, go ahead and raise your leg and raise the other one. Okay. Now I'm going to hold some resistance against it. Okay. All right. Again. Good job. And same thing with your feet. Go ahead and raise them up. Okay. And now against resistance. Okay, great. And then point them all the way down. And relax. And now down with resistance. Good job. Okay, I see all that good. All right. We're getting close to finishing it. If you want to, you can go ahead and sit up on the edge of the bed facing me. The same type of range of motion with your wrists. Okay, just go ahead and go up and down. Okay, against resistance. Okay, good. And then your shoulders to go in and out. Okay, good job. Okay, I'm going to check your tendons, your reflexes here, okay? Do it up here, just good, yep. Okay. Looks good. Okay. Good job. And I'm going to do a Babinski test, and I'm just going to watch and kind of see what your toes do, okay? Okay, great. So they did curl. And this time I'm going to have you go ahead and stand on the side of the bed, or edge of the bed. I want you to lift your knee backwards, like a hyperextend backwards. Okay, and with your other leg. And then back up to this wall. And turn around, please. And I just want to see you walk. Okay, good. And walk back to me. And right here with the Romberg test, I want you just to stand feet together, arms at your side, and close your eyes. And I'm going to push you, and I want you to see if you can catch yourself, okay?
Okay.
Okay, good. All right. So right now, what I see we have is, you can go ahead and take a seat, is mainly nothing else going on, just that cough that you've had for 3 to 4 days, and you are getting some stuff up, so it's good you're able to use cough drops to help relieve it. Maybe some things we need to look into is some smoking cessation, or at least trying to decrease how much you smoke a day, because for 15 years at 38, that's a pretty long span of your life, so if we can hopefully try to get some of that worked on, we'll be in good shape.
Okay.
Do you have any questions for me?
No, ma'am.
Okay, thank you.
Thank you.
So I just push it again?